the doctors were floored. However, still very, very skeptical. And they were trying to figure out what they were going to do. And the oncologist called me aside and said, can I see the equipment that you're using? I'm floored. I'm over the moon. I can't,
Right.
Dr. Bruce, I cannot sing your praises enough. These products are by far the best on the market. Hey, Dr. Bruce.
Hey, how are you?
I'm doing
Oh,
just fine, thank you.
you've been doing this for how long?
Approximately 3 years now.
Okay, so you're seasoned, but you're not a veteran. Some of these
Correct.
guys have been doing it for 30 years, you know? And what
And
type of
how
therapist are
and
you,
how
Liz?
I am a licensed massage therapist in the state of Florida.
Awesome. Whereabouts in Florida?
I am in Central Florida, Orlando predominantly, but my office is in Kissimmee.
It's a city I know well, know and love. I have very good friends there. So you've been taught by a lot of people, and you've got some great outcomes with the units. You've been having some fun. You had a great mentor with mom there in that sense. Um, and I think what was it? How long ago was it we spoke about? Was it your husband
Um,
who had it? Was your husband who had the issues?
my dad, my
Your
dad.
dad
So
had the
about a
issues,
year, yeah, about a year ago,
right?
was diagnosed with aggressive prostate cancer, and he was doing the chemo and radiation, simultaneously,
Right.
not getting great results. The medications, the chemo was really, really giving him a run for his money. And when we spoke and I mentioned to you about, was it because he has a pacemaker? Was it
Right.
safe to use? And you said,
I think that was the
absolutely.
initial conversation. You called me with regard to the pacemaker and whether it was
Yes,
appropriate to use, correct? I think that
correct.
was the initial conversation. So the scenario was you called me up with regard to your father's condition, which was prostate,
Pacemaker. Right.
pacemaker. And then we sort of got
The
into
pacemaker initially.
conversation and it went down the rabbit hole that you happened to mention that he had um, some PSA prostate issues, correct?
Mm-hmm. Absolutely.
And
Not
I
getting
said,
great results.
and I said immediately, I know what to do with that, correct? Or where to
Yes,
look.
you did. You
And I
did. And
believe,
I'll
go ahead.
and his doctor, his radiologist, as well as the oncologist, they were floored when they saw his numbers after I did just 2 treatments on him. His
Okay, so let's
PSA
back up.
went
So
down. Sure.
before we get there, so I do believe I said we gave you the protocol, correct? And I said check for midline scars on his head. I think that was what I said, correct?
Hmm.
And I gave you a protocol. And was he getting chemotherapy at the time?
Yes, both chemo and the radiation simultaneously.
Okay, good. So I gave you the protocol. You went and applied the protocol,
Yes.
and now you can
And
go
when
into it.
Yes, and when he went back to his oncologist and they were saying, "Well, we've just started with your treatment. Don't expect really a large change." And they looked at his PSA and they're like, "Wait a minute. This is way lower than when you came in. What's going on?" And he mentioned, he goes, "Well, my daughter, who's a massage therapist, has these probes and she's been using them on me and they're working like a charm. I have a lot more energy now. I'm not feeling down in the dumps." And the doctors were floored. However, still very, very skeptical. They kept saying,
Well,
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 that
yeah,
might be,
expect that.
yeah, they kept saying, well, this may be, just a fluke that's going on. But we'll know better. Tell her not to stop doing what she's doing, but definitely we're going to keep on top of this to see if you continue to get these kind of results. And sure enough, I mean, we're at a year and a half down the road, and he is in remission.
Oh,
And
wonderful.
I'm floored. I'm over the moon. I can't,
Right.
Dr. Bruce, I cannot sing your praises enough, because they're in shock themselves, and their center closed down, and they were trying to figure out what they were going to do. And the oncologist called me aside and said, can I see the equipment that you're using? And I said, absolutely. So I did. I brought it in and I did a little demo on him. I said, can I have your left hand? And explained what I was going to do. And he's like, I don't feel anything. And I said, exactly. You really wouldn't. It's all microcurrents. And I pulled out the paperwork that you had sent me for the pacemaker, and I said, it's safe. I've even sent this to his cardiologist. Again, very skeptical, but said, you know, if and you're happy with what you're seeing, then don't stop doing it. Keep
Right.
on doing what you're doing. So I did. I can have continued treating him, and not just for his prostate cancer, but he has Parkinson's, and the
Right.
shaking has stopped somewhat. It's not as um how should I say, it's not as predominant as it was before. It is slowing down. He's not shaking as badly. He is able now to sign his name again, that he was
Oh,
not be
really?
able, yes, that he
That
was not be
was
able
one of
to
the
do that.
first things that goes. They can't sign their names, or it
Correct.
looks like Trump. You know what I mean? Like it's crazy. It's like what crazy
Exactly.
thing. Well, he must
So
be pleased with that.
he's ecstatic. He's very happy. I haven't stopped there. I figured, my mother, elderly woman, has been complaining with pain in her knee, and she's bone on bone. And I started using the protocol for the knee. And
Mm.
by golly, the woman is, I mean, on days she's able to get up and do a little jig,
Oh, really?
which she was not be able to before.
Right.
And it's not every single day that she's feeling really, really good, but
Right.
more good than bad. And that
Right.
I
Well, that's
attribute
good.
to the MPS.
Okay. So the big success here is your dad's done very well with this. How old is he? I don't remember asking.
Dad is 86.
Wow, that's
That's
impressive
phenomenal.
outcomes for that age. Normally they
That's
would kind of
phenomenal.
just go, you know, make sure your affairs are in order and this and that. And we'll try to make sure that the exit is not um, as distasteful as it can be. That's normally the procedure and the protocol at this stage. So they must be a little bit shocked
Mm,
to be able to.
they're not sure what to
I
do
don't
with
remember
him.
getting a call from the oncologist, if you know what I mean, which would really
Uh-huh.
be the extra step. I mean, sure, we've seen this countless times, literally, with so many different disorders. The question is, will the physician take the next step to really investigate it and see why this is a statistical anomaly, which obviously it's not, or what? You know what I mean? You would think they would look at this more deeply, because that's an impressive outcome at that age.
It is tremendously. I even showed them the before and after pictures for another client that was
Right.
referred to me from your website for Bell palsy.
Yeah.
One visit, just one
Well,
visit,
you should
and
send those pictures. Did you
all
send those
the
pictures to us?
I did. I did.
Okay.
I
The
sent them
ones you've
in.
gotten?
I was, I mean, floored when I saw, and even she kept saying, I kept thinking that I'm so young, and my face is going to be distorted. And her husband called me and said, I can't thank you enough for what you've
Of
done for my
course.
wife.
Well,
Yeah.
yeah, nobody wants to walk around with a half droopy face. And I can't see any woman really, you know, embracing that as a, that's not going to give her a big spring in her step when she goes out the front door, is it?
No,
No.
her biggest happiness is she goes, I have my plump lips back.
Oh, really?
That's
So
what she
she's
was
got,
concerned about, the plump
oh,
lips.
the plump lips.
Yep. So
Well,
she
that's,
goes, whatever you're doing, keep doing because it's working. So yeah, I'm a firm believer that these products are by far the best on the market. I have used them on even patients that have COVID. In fact, today, the nurse's aide that takes care of my parents um, contracted COVID. And I told her, if you don't
oh,
mind, I says, I'll come to your home. I'll
right.
wear a mask. I go, but I will definitely, I will do what I've done for others and it'll help you with your symptoms. And I go, I'm not going to be that presumptuous to say it's going to cure you, but shy of.
Well, it's still got to get through you. That's the whole thing. But the process could be considerably nicer, you know what I mean? And
Mhm.
shorter. So we do have protocols for that. But that's wonderful. I'm glad you seem to be liking this a lot. You're going to really have to thank um, um, Helen,
Oh,
because if it
absolutely.
wasn't for Helen, then we
I
would
would
have
not
never
know about
met.
all of this.
And so she's really the catalyst for all of this. You should give her a call and a hug and say, Dr. Bruce says hi and says he deflected the I'm not accepting all the credit, that she has to have it too. She was always a big supporter of what we did. You know, she always showed our students. And obviously, it's if you let her know that, then it's give her a little bit of a extra step in the day. You know, as
Absolutely.
you get older or something, I don't like to say, you never know. You can't treat all the patients. When you train other people or introduce them to therapies, and they go off and treat, it's almost as good. You know what I mean? Because it's the next
Absolutely.
generation. You can sort of see a
Absolutely.
little tear in your eye going, oh, you did that pretty good. So it means you're passing it off to the next generation, right?
Yes.
So
Yes.
we like that. But I'm very pleased about your father and his remission in terms of the cancer. That's completely awesome.
It is.
And you have any other questions you want to ask her? I think we're all good, Liz. Anyways, we thank you for your time. You know, say hi to Helen for me, okay?
I most certainly will.
All right. You have a good day, Liz. Thank you.
Okay, Dr. Bruce, take care.